talk about GI bleed. All right, so there's really two types. So what are they?
Ulcer.
Anatomically.
So the esophagus or
Upper and lower. Okay, and what supports, what is like the anatomic marker for upper versus lower?
the ligament of tract.
Yeah, so right here. So esophagus, stomach, duo, and then your ligament of Treitz is where your duodenum becomes your jejunum, okay? So this is tethered down to the retroperitoneum, and it's very, it's like, have all of you guys seen that intraoperatively? You know what it looks like? Yeah, so you really can get down on there and pull the jejunum up, and you see this ligament of Treitz here. And so this is gonna be upper, okay? And then this is gonna be lower. What's this typical, like, stupid test question about what's the most common cause of a lower GI, like lower GI bleed? They say like upper GI bleed. It's kind of stupid, but it's meaning like someone has such a bad upper GI bleed that it looks like a lower GI bleed. Because what theoretically does an upper GI bleed look like versus a lower GI bleed?
Like the color of the stool?
Yeah, so upper is typically, quote, is, quote, melanotic stool, right? Like coffee, they could have coffee ground emesis, or they could have like a melanotic stool because it almost looks black because this blood products here gets digested as it's coming through the alimentary canal, whereas a lower GI bleed, so say you, give me some examples of what causes each. And so a lower GI bleed, like I said, is more bright red blood in theory.
So upper peptic ulcer.
Yeah, so the big one here is peptic ulcer disease, right? This is pretty obvious. So you have an ulcer here, you have an ulcer here, okay? And it bleeds. Oh, so tell me about this, because we had this in a note today, the Forrest classification. This was in a GI note today, and I forgot. So 1, I think, is a spurting, like bleeding vessel, right?
That's 1A.
1A, oh yeah,
Active
brace it
spurting.
down. Yeah, so this is like active bleeding, okay?
1B is active oozing.
1B is oozing. Okay, sure. So both of these are like, there's actual blood coming from the bed of the ulcer. Okay, 2.
2A is a non-bleeding, but with a visible
Vessel, yeah.
vessel.
Yeah, so that visible vessel is like, what's the thing called? Defolier, or however you say it. Defolier's lesion. It's like an actual arterial that you could see. So you actually see in this ulcer like a thing here. And by the way, test question, what's the thing that runs back here that allegedly will bleed if you have peptic ulcer disease, if it's posterior?
The gastroduodenal.
Yeah, this is your GDA in theory here, gastroduodenal artery. Okay, good.